Hello, everyone. Welcome to another edition of Medicare Monday. I'm your host, Joseph Katz, here again with CoverRight CEO Richard Chan. Richard, how's it going today?
Hi, Joseph. Going very well. How are you?
Great. Things are good. So we've had a bunch of questions about assisted living. And so I've done some research on my own about what is assisted living, and then is it covered? So I think what I want to do is just kind of explain what assisted living is for a minute, and then have you answer, like, is assisted living covered by Medicare? So from my research and the way I, broadly will define it right now, assisted living is a facility where someone can go to live and receive services, and those services can be, a meal or two a day. They may have medical services on premise. They may have people that can help you, get in and out of bed and those sorts of things. It's not a hospital. It's not a nursing facility. It is assistance. And so the question here is Medicare going to cover assisted living?
Yeah, that's a great question. I think the definition that you just mentioned is correct. We get that question a lot, actually, and unfortunately, the answer is that Medicare generally does not cover assisted living or anything really under the umbrella of long-term care. So the rules for Medicare are that they will cover something if it's considered medically necessary. Assisted living typically doesn't fall within that. It's not considered medically necessary. It's obviously considered like potential additional benefit if you can afford it, or you and your family can afford it. So typically, it's not covered. The only exception for something similar or kin or in that realm is that Medicare does cover something called skilled nursing facilities after a qualifying hospital stay. So what that means is if you have had an accident of some sort, you've gone to hospital, you've been an inpatient for a few days, over 3 days, and then your doctor kind of goes, hey, you can leave the hospital, but you need to go to a skilled facility so that, you can get your medication a certain way, or you need some monitoring, then that would be covered. But again, that's only if it's linked to a qualifying hospital stay. So it must be in relation to an incident or an accident that you might have had.
And to be clear, Medicare, and you're referring to both Medicare Supplement as well as Medicare Advantage, neither will cover assisted living.
That's correct. In most cases, none of them will cover assisted living. And, we also have, and I want to make sure the audience doesn't get confused with assisted living and home healthcare. So it's great that you defined it up front. Home healthcare is a slightly different story, and we've actually got a separate video and separate content on that. But yes, assisted living, a facility where you can get help with, getting in and out of bed, with, daily needs like some light medical assistance, like that is not covered under Medicare.
Great. Well, we have a blog post on this topic, which I'll link to in the description below. I encourage everyone to give a subscribe click and follow the channel for more updated videos every week on the topic of Medicare. And we look forward to speaking to you soon. And reach out anytime, hello@coverright.com. And you can check out the rest of our videos in our learning center as well, learning.coverright.com. Have a great day, Richard. Speak to you soon.
Thanks, Joseph. Bye, everyone.